I'm a plastic surgeon. All my life, I've been trained to deal with scars. And so a scar doesn't just simply happen. There's a causative injury. Every injury heals with scarring. And the amount of damage that is done, the thicker the scarring, the more intense the reaction of the cells called the fibroblasts that lay down the fibrous tissue and turn the collagen and all the connective tissue and turn into fibrous tissue, and it becomes scarring. And what happens, for example, in plastic surgery, if there's a burn, and that burn is allowed to scar, and no proper treatment in the initial stages, then what happens is that it develops what's called a contracture. And so when you talk about emotional scarring, when there's injury which is so deep within, layer after layer after layer, it ends up with forming hypertrophic scarring. And sometimes that hypertrophic scarring results in contractures. I call them emotional contractures. And that causes a dysfunction in whichever organ it involves. For example, if somebody has a heart attack and some area of the heart muscle becomes infarcted, there's no blood supply, it heals by scarring. And that's exactly what happens in the human life, in our journey. The amount of emotional injuries from childhood, what happens? We remember it, yeah, we can try and recall it, but the damage heals with scarring. That's why they don't disappear. When patients come to see me for treatment for scars, we can only make them lighter or fade it away by outside all sorts of treatment, but they are still scars. All right. Same with the emotional injury. So the emotional contractures that occur are the ones that stifle, they ensnare the person, that you become a prisoner within the scarring and you cannot react and you become dysfunctional. And that's the theme. How do I deal with this contracture, which is emotionally induced, to be able to function well?